This is Duke University.
Lonnie Matthews is one of an estimated 3 million Americans living with gout, a condition characterized by oftentimes debilitating pain and inflammation of joints. He is also among a small percentage of severe gout patients who either cannot take the standard drug treatment due to side effects or for whom the standard treatment simply no longer works. So when Lonnie had to stop taking the standard treatment a few years ago, the intolerable pain in his hands, elbows, knees, and feet returned, and there wasn't anything doctors could do.
I was ready to give up. I was in so much misery that I was just ready to give up. My life was miserable. I couldn't walk. I was wheelchair bound. I was confined to the bed for sometimes as much as 2 weeks. I broke my wife down because we lived in a 2-story home and I couldn't come up and down the steps.
Lonnie's doctors told him about a study at Duke University Medical Center that was testing an experimental new drug that had shown promise in early trials. The drug known as pegloticase essentially chews up excess uric acid, the root cause of gout, and converts it into another compound that is released into the urine. Lonnie was enrolled into the trial and says his uric acid levels subsequently plummeted and his gout symptoms vanished. Researchers say the study's findings are encouraging.
What we found was that pegloticase was able to lead to a very important reduction in uric acid levels in about 40% of people who took the drug compared to almost none in those who received the placebo. So that comparison was very important and showed that we can reduce uric acid levels in many people with otherwise known as what we have called treatment failure gout.
Researchers say the study also showed some reduction in the size of large crystalline deposits of uric acid that can occur in gout patients. While participating in the study, Lonnie, for one, traded in his wheelchair and time spent in a hospital bed for time out and about with his wife and their dog. He will no longer take for granted a stroll in the park or a ride in his golf cart. Researchers at Duke are continuing their study of the longer-term effects of this treatment. At the Duke University Medical Center, I'm Mike Garrison.
Produced by Duke University. Online at duke.edu.